Could you explain, as briefly as possible, consistent with being coherent, how it is that the United States wound up with the extremely odd, extremely dysfunctional, extremely complicated system that we have and that nobody else on the planet has?
There are lots of strands to this. So one of the important strands is that around the turn of the 20th century, 1910, medicine suddenly becomes much more effective than it's ever been. You have safe surgery because of anesthesia combined with antisepsis, combined with the fact that we can identify bacteria. So you have suddenly hospitals are effective. Doctors are effective. They can make diagnoses. We have the introduction of radiological techniques. The X-ray comes in 1895. So you get a blossoming of ability. Simultaneously, you get a change in training of doctors. They can't be quacks. You know, quacks are, there's a reason we call them quacks, or snake oil salesmen. They actually need to be trained. And so in 1910, we changed the training process in medical schools to make them university affiliated in hospital training. And that becomes, and we actually reduced the number of doctors because they have to have college education, the 4 years of training. And that goes, it becomes more important. Then after the war, the federal government begins pumping a lot of money into developing hospitals, into research at the NIH. Specialists become important. Insurance companies pay specialists more. And so you get this reinforcing effect. More hospitals, more research to do more, paying people who do these special things more. And then you get Medicare, which sort of puts it all on turbocharge because it pays a lot of money. And one of the things that happened with the passage of Medicare is they were worried that doctors and hospitals wouldn't take 65 years old and wouldn't take payment from the federal government. Hard to remember those days. And so one of the things the Johnson administration did is that they actually paid hospitals costs and money extra for their capital investment. So suddenly making a big capital investment, adding a wing, buying new equipment became profitable for hospitals. They could get more money from the federal government. So the hospitals exploded, getting doctors who could do all this technology. So you've got this mix of insurance paying more specialists, more hospitals, funded research, and it is all driving great advances, but a lot of high-cost care. And truth be told, we have a very dysfunctional system. We are unique in how dysfunctional our system is, but I think it's fair to say you go to lots of countries. I just returned from Switzerland. Plenty of dysfunction in Switzerland.
In Switzerland?
In Switzerland.
Are you
I know.
Sure?
I'm positive. So Switzerland is a country of 8 million people. Everything's organized. They have 26 cantons. Everything's organized at the canton level. So you take 8 million people, divide it by 26. And then they have 100 insurance companies for just 8 million people. I mean, and they can't streamline things. They can't. Every doctor is entitled to be paid. You can't say, well, you're not up to snuff, or we want to have good coordination between doctors and hospitals. Their hospitals haven't gone through a little more rationalization. So in a little place like Geneva, 500,000 people, they have public hospital, forget the private hospitals, 2,000 beds. I mean, just way out of proportion to need.
Is there also a kind of path dependence problem here, that somewhere way back in the past you do something or other, and that then sets you on a path which becomes crazily dysfunctional in a very different setting many years later?
Yeah, so as I was saying, we heavily emphasize hospitals. And so we end up with very expensive hospitals, expensive hospital care, and a lot of specialist care rather than primary care, which other places have emphasized. And it is path dependent. We have a way of paying, and it's hard you can't change that radically overnight. It's just very, very, not difficult, it's impossible really. So the best you can do is create a change of incentives and a change that'll evolve over time. And I think that's what the Affordable Care Act has tried to do.